On this episode of the ASC Podcast with John Goehle, we discuss the latest news in the ASC industry, review requirements for patients to go home with a responsible adult, discuss HIPAA issues related to AI assistants like Siri and Alexa. We'll review recent discussions related to site-neutral payments, and in our focus segment, we'll discuss payment cycle controls and fraud and abuse with Alex Pirotta of triValence.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We'd like to thank our sponsor of this episode, triValence. triValence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. For more information about triValence, visit their website at trivalence.com. That's trivalence.com.
Welcome to episode 198 of the ASC Podcast with John Goehle for September 14th, 2023. Recording from our studios in Spencerport, New York. This is Sue Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Operations Manager for Ambulatory Healthcare Strategies. We would like to remind our listeners that the ASC regulatory environment is a rapidly evolving landscape, and the material presented in this episode is based on the most current information available as of the date of recording. As such, it's important to recognize that this information may be subject to change, and we advise all ASCs to stay up to date with the latest regulations and guidelines that are issued by their relevant regulatory bodies. And joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies and one of the most respected experts in the ambulatory surgery industry. With over 30 years of experience, Mr. Goehle has authored over 10 books on the ASC industry and is a sought-after speaker on regulatory accreditation and finance issues.
So we are recording the week after we finished our semi-annual retreat with Ambulatory Healthcare Strategies. Had a lot of fun getting all of our employees together. We have about 24 now on our team, and it was great to have them all here. They were in our other studio, which we also call conference room, and we didn't have everybody in person, so we had people that were joining us remotely. And so we had a great time recording. We always record an episode, some interviews with all of our staff when we bring them together. But this one was particularly special because we recorded the interviews that are going to be presented for our 200th episode, which is coming up pretty soon. So we're very excited about that. I'm going to be heading off to Ohio next week for the state association there. I'm not speaking there this year, but we will have a booth, and we will be recording interviews with some of the other speakers at the conference.
And we had a survey at one of our clients today. The surveyor showed up much earlier than they were expected, so just kind of a heads up out there. I guess they're getting caught up. And
yeah, we're recording, what is today, September 14th, and the surveyors showed up today, and yet the expiration for that deemed status survey is not until the end of November. So this is one of the earliest. We've been seeing this happen periodically, and they just got the letter last week, I think it was, or maybe 2 weeks ago, indicating that the survey had been scheduled. It's a deemed status, so it was an unannounced survey. So just be prepared. I know a lot of people think, well, it'll be a couple months before they show up, but that certainly wasn't the case here. So the client's fully ready for it and they're in good shape, but it was a bit of a surprise. We kind of thought we had a little bit more time before we had to send a team out there, so that was kind of interesting. And Sue, you've been doing a little bit of research, and I've been doing a little bit of research on the possible impact on our industry of a government shutdown. As we are recording this in the middle of September, there is a a danger of a government shutdown. So, Sue, you and I spent a little bit of time looking at the possible impact for our surgery centers on that. Every shutdown apparently is somewhat different, but there's a couple things that we did find out. And I got some of this information from, and I'll provide a link to this, from an article from the Committee for a Responsible Federal Budget. And what they pointed out is for Social Security and Medicare, checks are going to be sent out, but benefit verification as well as card issuance would cease, meaning that new Medicare beneficiaries, might not be able to present a card upon admission. And this is what they stated. While unlikely to happen again during the 1995-96 shutdown, more than 10,000 Medicare applicants were temporarily turned away every day of the shutdown. It could also impact, I was also particularly interested in what possible impact would be for our CMS regional offices. We work with them quite a bit, especially with, time-limited waivers, 855B applications on new starts, things like that. And unfortunately, they didn't give a very clear answer as to whether those regional offices would remain open. But I think if you are, expecting a time-limited waiver approval, which we've mentioned before, take forever to get approved, or if you've got an application that you need to get that in, pretty quickly, just to make sure that as soon as the government is back running again, the 855B will be up and running. So I'll give a link to that, and we'll keep an eye on this. If we get any more information, we'll update you on that. So during the business office manager boot camp, which we did in August, an interesting issue came up. I think it might have been because my watch went off at one point.
But I don't know the answer to this, John, or something, whatever, Siri or Cortana, whatever it was.
Yeah, and Christina Benson and I talked a little bit about it, and what we realized is that, and then we did a little bit of research on this, is that there really is a danger from a HIPAA standpoint of our devices, things like Alexa, like Siri. I don't know what my watch is attached to, but it is it's an Apple Watch. But they're constantly listening, and there is a danger there with regard to privacy. Protected health information. So you did a little bit of research from Northeastern University, I believe, correct?
Yep, I saw this, a study. First, I had seen there has been, I think, only one lawsuit that was brought by some healthcare workers with some concerns about this. I'm not sure that really turned into anything, but I was curious whether this was a risk or not. And so I looked into a bit. So concern about smart speakers such as, like you said, Alexa, Siri, Cortana, I think is one of the other ones.
Right.
Possibly overhearing and actually recording sensitive or protected information. So it's especially become more of an issue as some people are working from home. And I know most nurses, doctors, they can't really work from home, but you might take phone calls, you might have Zoom meetings talking about incidents. And these devices all, of course, have that wake word, they call it. But there was a study in Northeastern University and Imperial College of London that found there are frequent misactivations caused by words or a combination of words that might sound similar to the actual wake words. Like, I'm sorry would awaken, the same as kind of, hey, Siri. Or Alexa could be, I messed up, I got something. So it doesn't have to be really similar sounding. It's not words you would necessarily pick out as being a wake word, like has happened with you with your watch or different things. All of a sudden, these devices will start to talk, and you don't even know what you said to kind of wake them up. So this can happen several times a day. They did they played a whole lot of constant conversations and paid attention to how often they were mistakenly woken up, and some were almost once an hour, some were maybe once every couple hours. And they do result in a short recording of up to 10 seconds each. And these recordings are almost always sent up to the cloud rather than just being kept in the speaker. So it is possible that people could hear these, whatever you were saying at that time.
And again, this information that's being stored in the cloud is not confidential. I mean, it could be reviewed by the organizations such as Apple or Google or whoever has created those devices.
They might be doing it as like a marketing type of a thing or something like that.
Or just making sure
to try to see what what people are maybe asking for, or because with the wake word, they want to know, are we answering the questions that people are asking, but they may be mistakenly hearing these other things. Or if people can kind of break into these, with like cyber attacks and that kind of thing. So it can be a concern. The newer devices usually do have a mute button, and there was another study where they found that it does actually physically disconnect the speaker from the power supply. So if you do use the mute button, you should be pretty safe with that if you remember to do that.
So I think the big takeaway here is, there is a concern about this. If you're using these devices, if you're working from home and have sensitive data, you might want to turn them off. Probably not appropriate to be using, Alexa in a surgery center, and you might want to disable Siri on any of those devices that are
your phone, your watch,
right.
all of those things now.
So, and we'll provide a link to that particular article. And then, Sue, you had some information about Pain Awareness Month, which is this month.
Yep, this month is Pain Awareness Month. So the American College of Surgeons put out a press release from September 6th that was titled 3 Tips for Managing Pain After Surgery. Dr. Jonas Stolberg is a member of the American College of Surgeons Patient Education Committee and the Vice Chair of Research for the Department of Surgery at UT Health in Houston. And he gave these tips for patients. But it's just a good reminder, I think, for everybody being Pain Month. I thought I would just kind of go through them quickly. So have a plan and be prepared, understanding the expectations for pain after your procedure and how you should manage it, as well as when you need to call the physician. So these are important educational things. Always managing expectations, because sometimes there is going to be some pain.
Right.
And if people know that ahead of time, it may just be easier for them to handle and not be quite so scary. And know what medications or other therapies to use for pain. Try using, they always recommend a non-opioid medication when possible, and knowing, that you can combine some of these. You can do a Tylenol and an ibuprofen, and just that schedule. Make sure people understand that they could, that can be a first line if you feel that will be enough. Consider heat, ice, or other complementary therapies such as massage or acupuncture, exercise and rehabilitation therapy. Maybe review with the patients what movements will accelerate the healing, if there's areas they should be stretching or moving, and which areas maybe they shouldn't, be moving at all, and kind of keeping still, and for how long. And when opioids are indicated, be extremely cautious. I think it's really important not to overwrite a prescription. Make sure that they have just what you really think they're going to need, and then they can always call in for more if they have to. Use it only as directed, and remind them to store and dispose of any of those, any extras properly. And be specific when you're talking about pain. Some pain you may just need to tolerate as a patient for a short time. So some questions that you may want to cover with the patient. How limiting will the pain be? What if it hurts to breathe? Do I then call you? What if it hurts, but you're still able to do the daily tasks that you usually do? Is that just something you want to try to get through for a couple of days? And when will the patient be back to their normal functions? So those are just some quick, easy ideas to make sure you're covering, managing those expectations. And the article also, which we can put the link to, it had a link to some good handouts, templates, and charts that patients can use to monitor their pain or to guide, any questions they might have.
And I do need to point out that, the accreditation organizations do have specific accreditation standards related to pain management. And we expect them to those organizations to have policies that deal with pain and have tools that they would be working with the patients that are age appropriate. We know that young children, of course, can't verbalize a number, but they can use a picture. So whatever you have, make sure that you have a good policy on that you have good training, evidence of training of your staff on how to manage pain.
And that the anesthesiology associations also had some information on this, but that was more of a chronic pain thing. And I think it's, any pain centers out there, it's a good time to kind of, reward your staff, or just, put out some information on your website or something like that about National Pain Awareness Month.
Sue, when I was in Illinois a couple weeks ago for the state association meeting, one of the attorneys was talking about price transparency. And there's some new regulations in Illinois that talk about price transparency. New York also has some price transparency regulations coming up. It takes different forms, having to publish information on a website, having to communicate with the patient prior to surgery exactly what the charges are going to be. But it also brought up an interesting conversation, because all of this price transparency is, to make sure the patient is well aware of the different costs of the different sites. Like, is it going to cost me more to have the procedure done in a hospital compared to a surgery center or a physician's office? So the government is looking for, to really, first of all, make sure the patients are fully aware of those price discrepancies. And then the long-term goal of CMS certainly is to move toward what we refer to as site-neutral payments. What they mean by that is, site neutrality is the policy of having Medicare Part B, which is how ASCs are paid, pay the same amount for the same service with the same case mix, regardless of where that service is being provided. So, for example, we know that HOPDs are generally paid almost twice what ASCs are paid for the same procedures. So, and MedPAC has been, making this recommendation for quite a number of years that, there really should be site neutrality here, and that patients shouldn't have to pay more to be in another environment. And this is picking up steam. In a recent op-ed in the Wall Street Journal, former Louisiana Governor Bobby Jindal and the Center for Healthy America at the American First Policy Institute advocated for site-neutral payment policies for outpatient care. And they were advocating for the shift by explaining that it would save the Medicare program billions of dollars. There were some numbers out there. I didn't quite want to quote them, but billions of dollars, it can certainly add up. Even though, ASC payments are a relatively small portion of the Medicare budget, it's still, the more we move into the ASC setting away from hospitals could significantly reduce the Medicare spend. Then there was an article in the American Hospital Association website, and I'll provide a link to it. And in this, there was a letter to the editor which was talking about site-neutral payment policies. And the title was Site-Neutral Payment Policies Fail to Account for the Site Differences. And in this letter, which was published on August 1st, the American Heart Association president and CEO, Rick Pollack, responded to Bobby Jindal's and the Center for Healthy America at the American First Policy Institute op-ed piece. So he's basically refuting what Jindal was talking about. And he said, so-called site-neutral policies fail to account for the differences between hospital outpatient departments, or HOPDs, and other sites of care. And Pollack wrote, HOPDs treat sicker, lower-income Medicare patients than those dually eligible for Medicare and Medicaid with more complex and chronic conditions than those treated in an independent physician office or ambulatory surgery centers. HOPDs are also required to comply with many more regulatory and safety codes and provide 24/7 standby capacity for emergencies. And his comment is it's appropriate that they be provided with differential payments. And he went on to say that existing site-neutral payment policies have already hurt hospitals, and under current law, the vast majority of off-campus HOPDs that weren't billing Medicare before November 2015 are already paid at a site-neutral rate. And we know that for a fact that new HOPDs that are going off that are not on on the campus of the hospital are paid the same rate that the NASC is. And then he, again, went on to continue to say health insurers and private equity firms, not hospitals, are responsible for most of the acquisition of physicians during the past 5 years. As polling has shown, most physicians are choosing to become employed rather than to operate their own practices due to increased costs and burden from policies like commercial insurer and prior authorizations. So, Sue, I have a bit of a problem with this. I mean, I hate broad brush comments. I do recognize that hospitals do take care of sick patients, but to say that physicians' offices and ASCs don't treat, sick patients or don't provide care to Medicare and Medicaid patients is really quite misleading. Especially, post-pandemic. We know that as a result of the pandemic and as a result of the shutdown there for a period of time, surgeons had no choice but to move cases into the surgery center, and thus having to take on sicker patients at that point. And many of those doctors, once they realized how great a surgery center is, they didn't want to take them back to the hospital. And they also realized that they could, that we could take care of it. And I think that's a trend that's going to continue, that we are going to continue to find ourselves, really taking on sicker and sicker patients here. So I think this article or this argument that the President and CEO, Rick Pollack, made is, is a little misleading. Let's put it that way. Yeah. I don't have a problem paying them more, but I think that there's got to be a limit. And another comment that I really didn't like is that he said HOPDs are also required to comply with many more regulatory and safety codes. Well, that's not true at all. ASCs have at least as, and in many cases, more restrictive regulations, simply because when these laws were created, they wanted to protect the patient against those surgery centers that might have, try to cut corners. So we all know, and many of you out there know, that indeed we have at least the same standards and perhaps more. Where he is correct is that we don't have 24/7 standby capacity for emergencies, and that is certainly correct. So as I said, I don't have a problem with a differential. The question is whether they should get twice as much payment as we do. And then a last comment I'd make is that, also recognize that we have to be careful about fighting for this too much because the cost advantage is one of our best selling points. So if we did go to site neutral payment, then we would get reimbursed the same that the hospital does. And we wouldn't be able to make that argument that we make to the government, to the patients, that, you're going to save money by coming to a surgery center. If we're all getting paid the same amount, then that argument, that cost advantage is no longer there.
And then we wanted to move on to some recent experiences. We've seen, I don't know if it's an increase, but a continuation of patients being discharged without a responsible adult. It does seem like it has gotten worse since the pandemic. And in certain areas, it's especially bad when people don't maybe have family or close friends around and they really have nobody to go home with them. But it is a requirement, and, it's just a huge safety issue. So we just wanted to address that and talk about the standard.
Yeah, it's hard to tell whether there's been an increase in the number of this, but I've seen it coming up. There was a discussion in a recent Ask a Connect, posting. Yeah. And I was happy to see that all of the responders did say that this is not a choice. You have to follow the standards. So let's, as we always try to do, take it right back to the standard. So this is 416.52C, and the standard is for discharge. Go ahead, Sue.
It says the ASC must ensure all patients are discharged in the company of a responsible adult, except those patients exempted by the attending physician.
And the interpretive guidelines for this particular section goes on to state that unless the physician who is responsible for the patient's care in the ASC has exempted the patient, the ASC may not discharge any patient who is not accompanied by a responsible adult who will go with the patient after discharge. ASCs would be well advised to develop policies that address what criteria a physician would consider or should consider when deciding a patient does not need to be discharged in the company of a responsible adult. Exemptions must be specific to individual patients, not blanket exemptions to a whole class of patients.
And I think that's really important because even though you may have policies developed that will mention the type of criteria to look at, they can't just say, all patients with this meeting this criteria. It has to be, as you said, that specific patient.
Right. And by the way, we also ran into a situation, didn't we, recently, where a surgery center was actually, when a patient showed up and did not have a responsible adult, the patient was asked by the surgery center to sign an AMA against medical advice.
Completely wrong use of it.
Right. Well, before the patient even went in.
Yeah.
Which, the rule is if you can't even have a patient come in if they are going to tell you that they're going to leave against medical advice. So that could be, that was a really scary situation because it was very ill-advised there and could really get into a lot of legal problems. So, certainly don't sign an AMA when a patient goes home, without a responsible adult. And as you said, Sue, this is becoming a problem. It's a big problem in a lot of our urban centers where, they're, especially elderly patients might not have a responsible adult. They might live in a community or in a place where there's other people in the building, but they are not coming with the patient. And I truly understand and I truly respect that, we want to accommodate these patients, that they need this care, that they, it's not their fault that they don't have a responsible adult. And I understand how surgery centers and the doctors want to accommodate these situations, but this is a significant safety issue. A patient, especially that has, had a significant amount of anesthesia, even after a couple hours might not be fully recovered from this. So we have to follow the rules here. And you as a surgery center have to enforce it and cancel the case that the patient doesn't have a responsible adult. And you can rely on accept those patients exempted by the attending physician, but you have to have established protocols that identify when this would be applicable. And remember that the interpretive guidelines specifically state exemptions must be specific to individual patients, not blanket exemptions to a whole class of patients.
And you do have to be careful because some patients will come in saying that they've got somebody to drive them home. And we've seen some centers that either ask to speak to that person, let them have the phone number so they can call them if they haven't come into the center yet. We've heard of a center that was transporting patients to the hospital by ambulance if they couldn't go home, but that may not be covered, and the patient will be very upset. Yeah. But it's important that you make clear to them, the seriousness of it, and that you may have to cancel if they come in without somebody.
Right, and the doctor needs to understand that when they exempt those patients, they're going to have to write a note. There's no form that you should be filling out for this. You got to write a note that explains why that physician determined the patient was eligible. Be very specific about that, and of course have policies that have been agreed upon by the medical staff as to when you would be allowed to exempt them. Yep.
And they are taking responsibility, as is the surgery center.
Right, they're taking a lot of risk, I think, if a patient is harmed as a result. And, we have 80 centers. We have had injuries. We've had injuries with people, even with a responsible adult, where the patient has fallen, between the surgery center and home, let alone what could happen if a patient doesn't have a responsible adult. So, again, a hot topic right now. Surveyors are definitely looking for it. We had a center that had it not an immediate jeopardy, but did have a condition level citation as a result of their failure to do that. And, again, they were trying to do the right thing because they're in an urban area. None of their patients ever, came in their own vehicle with, it was all public transportation. So going home on public transportation without a responsible adult is, of course, dangerous too. Yeah. Okay, so let's move into our second segment here, just as a bit of an introduction. We have been focusing a little bit more recently on finance, as some of our listeners have pointed out that they, our focus on regulatory is good, but they every once in a while want some finance discussion. So we talked to our friends over at triValence, and they agreed to talk a little bit about accounts payable. We all are trying to find ways of saving money, and one way of doing that, of course, is to make sure everybody is really shopping well for the lowest price, which includes going to different sources, comparing those prices, and of course doing this in the environment where you're under a lot of pressure to do this quickly, and of course that results in the possibility of people placing orders for products that could have been cheaper, or doing things without a proper authority. If you're not careful about making sure that your employees know that that any purchase has to be approved by administration. You could run into situations where you've purchased or paid, more for a product or purchased more of a product than you really need. Having controls is extremely critical in the accounts payable cycle, and just to assure that staff who order, are not overbuying, as we said, and controlling the pricing, making sure that you're always getting the best prices. So let's take a short break, and we're going to have an interview with Alex Pirotta over at triValence about this topic.
Do you work long hours at your ASC, ordering from multiple vendors or managing back orders? Do you manually track POs and invoices? Do you need help sifting through paper to find payment discrepancies? Most ASCs are understaffed, overworked, and wear multiple hats, which leads to burnout. triValence launched an intuitive procurement-to-payment solution that optimizes your ASC's performance and removes the frustration from daily tasks, allowing for a happier, more productive staff. The triValence solution streamlines the disjointed supply chain in your busy surgery center, from ordering supplies to managing your purchase orders and invoices to making payments. The platform provides a robust dashboard with actionable reporting and lets you track your spending down to the penny. Visit trivalence.com to schedule a demo or learn more about this all-in-one solution. That's trivalence.com.
So I'm here with Alex Pirotta. He is from triValence, and triValence, as we all know, is one of our sponsors here. So, Alex, would you like to introduce yourself?
Yeah, sure. Thanks, John. Thanks for having me. I've spent my entire career really focused on growth stage companies, primarily with technology companies, anything from software in the music industry to point of sale financial services for the restaurant industry. And more recently, even a management services organization that was managing orthodontic clinics, and then sort of eventually made my way over to the triValence team and back into the world of technology, and really just focus on building the finance function and just guiding the team through a finance lens as we continue to grow the team and build the product.
So when we were talking to triValence about what types of discussions we could have, one of the points that I made is that we really haven't talked about internal controls in ambulatory surgery centers. You know, we all know, as a former auditor, and you're an accountant also, we all know that, ambulatory surgery centers just don't have the resources that large organizations have to be able to implement strong internal controls, which means that usually there has to be some type of accommodation for that, just to make sure that, you don't have fraud occur or even errors in transactions. And a big theme that we have had on the podcast in the last 6 months, I would say, is how can technology help solve many of our operational challenges that we have? So that really fits into this whole conversation here. So let's just start, Alex, by talking about what are internal controls and why do we have them in the first place?
Yeah, absolutely. And as a former auditor, the different types of controls that are out there. But generally speaking, when we think about controls, I think of them as kind of three main categories, right? You have your preventative controls, your detective, and then sort of corrective. The name might partially describe exactly what they're meant for, but a preventive control is really meant to prevent that fraud or that error before it happens in the first place. So think of something like an approval on an expense report or an invoice before it's paid, right? You can kind of catch an error or catch some fraud before you actually release payment. Then on the other side, you have detective controls, which are sort of backwards looking in the sense that you want to detect fraud or an error after it's already happened. So, the one I typically think about is looking at changes in financial reporting over time. Like, look at your fluctuations, like what doesn't intuitively make sense when you look at the last 3-4 months of history of costs or revenue or whatever it is, knowing the broader concepts or context of what's going on in the organization or the larger macro environment, right? Like what doesn't kind of fit together. And then the last is, of course, corrective, meaning, what are you going to do to stop it from happening next time? This could be anything from like, maybe you've found an employee who's committed some sort of fraud and we have to, terminate that employee or move on, or implementing a new policy or a new procedure to prevent future fraud or, prevent future errors from happening. So those are broadly the way that I think of controls, is kind of those three major categories. And, there's various ways, of course, they can be implemented.
So let's talk for a second about the types of controls that generally, those preventive controls that are out there. You mentioned, approval of purchase orders. Let's just take that extra step. That would include also making sure that, when a product is received, there's a receiving document with a signature from the person receiving it. And then that next part of it, the receiving document, the signed purchase order, that all goes to the person who receives the invoices. And then they review the invoices, compare it to the purchase order, the amount, quantity, and price, and make sure that the same number of items that were ordered were actually received, and that the invoice reflects proper information there. And I think I've said this on, I don't know if I've said it on podcast, but I've said it when I speak. When I was an actual administrator doing like real work in a surgery center and signing off on checks, I was shocked at how many invoices were incorrect. And that if we had just paid them without double checking the purchase order and the receiving document, we would be overpaying people, or organizations overcharging us, a fee that we didn't agree to, or telling us that they had provided us like 10 widgets and we only got 5. And those are significant controls that you need to make sure are in place. Something that's easily put into place. Even in a small organization, you can do that.
Yeah, I would agree. I think there are certain things that are very easy to implement, right? Like I think folks might think of internal controls and immediately say, "Oh, that's just for a really large organization.
Yeah.
That's for multi-site groups or folks that are SEC filers, right? Like very large organizations." But there is a way to scale these down in very simple context, right? You don't need the most robust internal controls for a single location, single surgery center, right? But you want to have something in place that's going to prevent, to your point, pricing error, receipt error. Maybe there wasn't a proper three-way match, right? Like there's simple things that you can sort of put in place to prevent these errors from happening. And there's lots of advances in technology, of course, over years that can help with these sorts of things. And I think there's just many ways to do a smaller scale internal control that's going to have a bigger bang for your buck than trying to just say, I'm going to put in the largest, most complex internal controls overall.
So actually, let's step back a second and talk about the prevalence of issues with regard to fraud in a surgery center. And so this would be a very quick conversation because we don't have statistics on it. First of all, there's no national statistics out there, and not a lot of people want to admit to it happening. I will say, at Ambulatory Healthcare Strategies, among our 80 clients, we've had, we're not involved in the finances, we do regulatory, but we've heard as part of our conversations with the clients, there in the last 18 months, there's been 3 incidents where there's been some type of fraud, usually not a large, well, actually, none of them were a large dollar amount, but in each case, disciplinary action had to take place. So there's that side where people purposely rip you off. The other part of it is just errors getting into the system. So internal controls are not just there to make sure that we don't allow somebody to abscond with our money. They're also there to catch errors, innocent errors usually, in the system.
Yeah, absolutely. I think errors can be sometimes even more prevalent than fraud, right? Especially in a smaller center setting, right? Like, generally everybody knows each other. These aren't like, very large organizations where you have folks that maybe intentionally or maybe just don't have the right area of focus and they're intentionally trying to rip somebody off, right? But in a smaller setting, it's generally just an error. And that error can stem from maybe the pricing didn't get updated when a PO was submitted, or maybe the pricing that list that somebody, when they called in an order, had a different price than what the vendor had, whatever it might be. Those can all flow through all the way through sending off that payment and sending off that check, unless somebody has a way and sort of a break point, right, at every kind of step of the process to say, is this right? If it's not right, well, return to sender, go back and go fix it, rather than just continue on the same workflow. Because you could very easily see it as a smaller center where an invoice comes in and you just write a check and you pay it, and you could do that for 6 months, years and years, and one day say, wait a second, this price is wrong, and it's been wrong for 5 years, and at that point,
that product,
right, and at that point, you didn't really have much of a preventative control in place to catch it. You didn't have sort of a timely detective control, right? Because you were looking at it 5 years later. But there are just ways to kind of think through the different, kind of breakpoints, if you will, along a process to figure out how can I check and just ensure before going to step 2, before step 3, that everything looks correct here.
Yeah, and again, some of these can be very innocent. I mean, even my own billing system for my clients. We had a situation last month where one of our clients was sent 2 bills the same month. One was the beginning of the month, one was toward the end of the month. And the client, bless their heart, and I don't mean that from the Southern standpoint. I mean, they were very nice and they paid both of them. And then I came back and said, wait a minute, you overpaid me here. And that's my mistake. We just credited it to the next thing. But if I hadn't been watching it, it might have taken a little bit of time for them to catch it too. So that brings us to the ramifications. What are the ultimate ramifications of these errors or the fraudulent activity? And do you want to talk a little bit about that?
Yeah, sure. So, I mean, I think without having the controls in place, fraud can occur from, many different standpoints, right? Somebody could be ripping you off. They could be taking product and it's not being used in the center, or it could be, used for personal, use somewhere else. And then there's also just dollars that are leaving, right? There's dollars that are leaving the center that are paid to a vendor, and maybe the vendor doesn't even know that something's wrong, right? Like there's just so many ways and areas for sort of fraud and abuse. It could be at every individual level across that process. And so, it's sort of challenging to say, here are the only 2 or 3 things that happen. It could be anything, and you don't really know until you know, and it's too late. But by really focusing on the controls, you're going to mitigate your risk, and you're going to mitigate the chances of having money leave your bank account without you knowing or understanding if it's correct.
Right. And that's the point we're trying to make here, is that you need internal controls to assure, because one thing is for sure, errors are going to occur. They're rarely in your favor. I don't know why that happens. They're rarely in your favor. And it's one thing when you're making a lot of money, but and you don't care so much about that. I don't know that. I mean, as accountants, you and I probably have a real aversion to that. But doctors, when they're making a lot of money, they don't think so much about that until their check starts getting smaller. And then they start asking those questions. So and we encourage everybody to make sure you have some of the most basic internal controls, like what we've been talking about here.
Yeah, I think that's a great point, especially for a physician who's seeing their bank account and they just monitor. They think of that as their control, right? They say, at the end of every month, does it have the amount of money I think it should have?
Right.
Okay, then probably okay. But to your point, over time, it can be little, it can be dribs and drabs that just kind of slowly change that number where you might not notice it right away. But there could be, things happening over time that could just continue on unless you go and correct them.
Now the question is, who's responsible for maintaining these controls? What individuals within the organization or outside the organization can be brought to bear. And again, before we start getting into technology, let's just talk about where we are right now with the human element being involved in this.
Yeah, absolutely. And I think internal controls, the person ultimately responsible is going to be different depending on the size of the organization.
Yeah.
However, I always feel like internal controls are actually the responsibility of anybody who is like part of the process or part of the transaction. And the reason for that is there should be, kind of separate approvers, right? The same person who is entering an invoice, for example, shouldn't necessarily be the same person who's paying that invoice. And you, an additional control there, and in our accounting world, right? That's your separation of duties, right? But you have different folks focused on different things. But I think that ultimately it's everyone's responsibility to ensure that once a control is put in place, that it's being followed. Mm-hmm. And ultimately, whoever is looking at the bank account, they're the one I think it's generally going to be ultimately responsible. However, they sort of need to put the control and the process in place to sort of empower the individuals who are working throughout the day or working through a transaction to be responsible for it.
And we also have to be careful about collusion. So the more people that are involved in the process, the better, or as part of that control, the better. And also be very careful about collusion, either people that are friends that decide to collude. Again, now we're talking about fraud. Or one of my ongoing issues with a lot of our centers is that, there's a lot of nepotism. In fact, our company is got a lot of nepotism because we have so many family members working for it. But when you're dealing with internal controls, you got to be very careful about relationships there to make sure that anybody that's involved in that transaction is not, related in some way or super good friends.
Yeah, absolutely. And that's where, again, having like a clear understanding of the different types of controls and where you can implement the controls can be helpful. And, even at a smaller center, you're not going to have 5 people who are going to touch a transaction, right? Now, in an ideal world, maybe you do have many handoffs along the way so that, a transaction can kind of hit all those different breakpoints, get certain approvals from people that don't work together, right? But at the end of the day, you often have one person who's paying your bills, right? And you just need to have put in as many controls and breakpoints as you can around the frame, the individuals you have working at your center.
And you can outsource some of the controls. If you have an accounting firm that works with you, well, everybody probably has an accounting firm that works with them, but you can use the accounting firm, for example, to do your bank reconciliation as one step of the process, or even hire somebody to come in periodically to assist in the transaction cycles. But that becomes, kind of an expensive option for them. The more duties you give to an outside firm, the less money you have available, less profit that you have. So, which leads us to the next conversation, which is how can technology help us? So why don't we start talking about that?
Yeah, absolutely. And I think just broadly, I think, technology is meant to do these sort of tasks, right? Like when I think of why computers, were initially built, they were meant to kind of take the manual tasks and sort of these monotonous sort of processes and be able to just offload them to a machine, right? And let the machine do them. And I think a lot of what, technology can do in this world is sort of exactly that. It's sort of like, let the computers talk to each other to go, ensure that you have the right pricing, you have the right quantities ordered, or you have the right, you actually receive them and somebody can kind of confirm that back to the computer, right? Like rather than, having somebody make a phone call every time they want to place an order, right? Like you can have the computers can do all of this stuff between each other. And so that's how I think of where technology can play the biggest role. And I always think of healthcare broadly has just been ripe for, technology to start playing a bigger role. Healthcare systems are generally disconnected, right? The systems are not fully integrated. Yeah. There's not a whole lot of sort of embedded different types of technology that are kind of holistic solutions out there. And so you often have things where you're placing a purchase order in one system, or you're placing it by phone, or you're using another system to track your expenses. And then there's another system for making the payment to the vendor. And then there's even another system where you're recording everything in your general ledger for your accounting purposes. And just that lack of integration causes all sorts of pain to just maintain effective internal controls. And so by finding ways to bring the technology together for sort of an end-to-end solution, which is, part of the reasons why I joined triValence, is I think it's, really focused on the ASC operator in just ensuring that we can get from point A to point B through the entire process without having to worry about, what's in between and, making sure that there's a controlled environment in between.
Yeah. And to your point, we have so many separated systems. We might be using QuickBooks, for example, to manage our accounting and check writing. We might be using SIS, one of our other sponsors, for handling your accounts receivable function and maybe the purchaser function. And then you've got human beings involved, and then you have an ordering system that you're set up, to do online. You might be using the internet for all that. A lot of your invoices might come back, by email, but none of those things are necessarily connected right now. And a lot of it is because our industry is like a very small compared to all the big guys out there. Hospitals have like very complex computer systems that can handle all that, but I don't know of a computer system that can handle, billing, check writing, general ledger, accounts receivable, all of those other functions that you really need in order to run a place, or at least one that's affordable. Let's put it that way.
Right. Yes, you could probably build your own, but it would be pretty expensive. And yeah. Typically what you see, and this is not too dissimilar with other industries, is you end up sort of taking vertically focused different software solutions and saying, okay, well, this one's good for billing, and this one's good for accounts payable, and this one's good for scheduling, and you kind of try to link them all together. And sometimes there is enough of an integration that they work, and then other times you're left with taking one thing from system A and somebody's manually entering it into system B, and on it goes, and it's just not ideal. And I think there's healthcare overall is just sort of ripe for more technology infusion there.
Well, and let's face it, since not a lot of doctors listen to the podcast, often our doctors are, shall we say, not inclined to spend a lot of money on different systems. And they might be looking for the cheapest solution in a number of different areas without, as you were saying, without even thinking about that integration that might be available. And not just, a lot of our administrators and business office managers might not have, the level of computer knowledge to be able to figure out or be able to identify solutions that would be fully integrated. We don't find a lot of CPAs, for example, running the business office or people that have a, very intense or extreme level of knowledge about this, like you would find in a larger company that has those strong controls.
Yeah, completely agree. And I think since you brought it up, I think you're right there. I think what I've seen is like one of the biggest surprises to me is just how adverse to adopting new technology, or even just slow to adopt new technology exists kind of in the industry. And no one wants to be the early adopter, right? No one wants to take the chance on bringing in a new technology and until they see their peers doing it, right? And and even then, it's like, well, what does it cost me? And like, how do I understand my ROI and my savings? And it's often not just a pure dollars and cents ROI, right? Like some of it is internal controls related, and it's going to help you prevent future fraud or future errors. And then some of it is manual work, right? Like the things where, maybe it saves your administrator a couple hours a day, a couple hours a week to have a technology system do something. And that's time they get back to focus on patient care. And those are the things that are really hard to quantify, which I think, in the industry kind of makes it harder for folks to just dive right in and be that early adopter. And, by myself coming from more of the technology world, is I always looked at this as like, if I don't look at the new technologies, I'm losing some sort of competitive advantage, right? Like, I've been building accounting and finance groups in the past, and it's almost common for me to go take those risks and go look for those new products, because I can build my teams, I can build out the organization with fewer people, right? And can rely on the technology and the tools that are available to do this sort of heavy lifting, if you will, right? Again, back to our my point earlier around why we invented computers and why they're here, right? They're meant to do the heavy lifting. We have snow blowers instead of shovels, right? Like there's reasons for these things, and we got to take advantage of them whenever we can.
Absolutely. So how do you think, I guess this is a 2-point question. How can we maximize the use of technology today? What tools are out there today? And of course, you have one of them, acknowledging that, but also, just talk a little bit about the current state there, and then we'll talk a little bit about where we might be heading in the future. Yeah,
maybe I'm a little biased here working for triValence, but it's one of the reasons why I joined the team, right? I think there's a lot of folks out there who are still using pen and paper for the entire expense management and just payables process. And from my perspective, that's the easiest place to go replace. If you're on pen and paper, like there are technologies that can do at least one of the processes along the way from placing that initial order. And when I say pen and paper, that can involve making a phone call, sending an email. All of those are sort of the very manual sort of ways to go, place an order, if you will. And I think there's just, many different technologies along the way. triValence happens to do kind of the full suite of, actually placing that initial order all the way through getting that vendor paid. But, these types of technologies exist in our personal lives, and, they exist in the business world. We're just not always as quick to jump on them and quick to use them, but they exist and they're there. And there's many opportunities, I think, to gain efficiency and different levels of control. And one of the bigger aspects I always think of too is visibility, right? When you have sort of a controlled environment, or a place where you have one vendor, one solution kind of, solving a problem or solving a process for you, you get visibility into your business, a little deeper than you would if you just have paper invoices sitting on a desk and a stack of checks sitting there that eventually maybe get entered into QuickBooks, or you just get like a different level of visibility into your operations.
And Alex, in our own personal lives, think about this. First of all, I'm trying to break my habit of ordering everything in my life from Amazon because I really don't feel like I need to make that guy any richer. But Amazon is a simple solution. It has revolutionized the way we buy products. It's revolutionized the way we pay for it, receive it, track it even. Is amazing. I mean, we get it seems to me 4 to 5 deliveries a day from Amazon, and at any given time we can pull up on the computer to find out what's coming in, make sure it was paid, make sure that we ordered it, and make sure that we, obviously paid the amount that we thought we were going to pay for it. Why wouldn't we expect that in our business too? If we wouldn't think about anything else in our own personal life, as much as we hate making the guy any richer, Why wouldn't we look for that in business? And when I think about your product, like triValence, I've always referred to it as the Amazon of the healthcare world. That's not fair because it's actually much more advanced than that. But if you want to try to explain to somebody how it works and how it fits into something that, we're used to and expect in our own daily lives, that's the way I look at that. Where do you think this is going? First of all, you don't have a lot of competition right now. Where do you think the market is going? You're going to have to kind of admit at least where the market is going here.
I think where the market is going is slowly but surely adopting more new and more robust technologies, right? And I think triValence is coming along at a time where, you do have other solutions out there that do portions of the entire procurement through payment, process, but not many, or if any, I don't think there's any that are doing the full process from beginning to end. And, when I think of the biggest value add of something like this is you have added efficiency, you have improved accuracy, and then you have enhanced visibility. And so by bringing kind of the entire process together in one platform, to your point, like in Amazon, you get all of that. You get your efficiency, you get your accuracy, and your visibility into how your business is operating. So I think that's where I think the future is going, right? Like this has happened across many different, business, different sectors and different markets across the board, just in terms of adoption of technology and how things have moved. Like, I always think of restaurants because, we're a prior employer of mine, but, for the longest time, it was all pen and paper, right? You wrote down something and now it's, sometimes there's kiosks and the customer walks right in and they place their own order, it goes right back to the kitchen. You have all these different channels to go work through the process. And I think over time, the industry will get to something like that. It's just, we're in the very early stages of it. Adoption is very slow and, we'll start to see some traction with newer types of technology coming out as well.
And one thing, so a couple warnings that I think we need to make sure our listeners hear is be very careful about a single vendor solution. There's a lot of vendors out there, distributors out there that would like you to use their product, and they build into it some of the same. It's kind of like Amazon was in the beginning. When Amazon first came out, they sold their products through their warehouses. They were the sole source, and of course, you have to be careful about the price that you're paying for it. I'm sorry, Alex, I hate to keep bringing Amazon up, but it's something like all of us know about. But now you can go on their, the portal and buy from, multiple different vendors. You can look up different prices, which is the value here. But I know that there's a lot of vendors out there right now, distributors out there right now, even manufacturers that are encouraging people to use their kind of proprietary website, which you got to be careful about getting too, or purchasing system, get too tied into it because you might not, they might not be able to supply everything, or you might not be able to double check, make sure you're getting the best price, or people might get lazy. Oh, I'll just go online and do this without doing that double check that they need to make in order to make sure they're getting the best product, the best price, and the best delivery terms.
Yeah, and I think there's definitely a challenge with having a single vendor for everything. I think what is always important is to have your backups, right? I think I'm sure folks during COVID and some real hard supply chain issues were looking for multiple vendors and looking for different resources. But by a concentration into just one can cause you problems when you have something that comes up, whether it's a internal issue at an individual center or more of a macro issue. I think the concentration risk is too great. You kind of always want to be able to understand what other vendors are doing. And to your point, making sure you're getting the best price, almost to keep everyone honest, right? Like if you just were buying from the same vendor for years and years and years, have you ever talked to, vendor B, right? Maybe they're able to do something a little bit more competitive on pricing because pricing changes over time, right? And, maybe they can help, maybe they can't, but I think it's worth, keeping that sort of check and balance in place.
Well, and to that point, we got to be very careful about our purchasers. They're overwhelmed. Their job is, they got the nurses yelling at them to get the product in 5 minutes. And, they're trying to find the best price. They're trying to manage the whole department, make sure that they don't run out of inventory items, count their inventory items. Often they're a one-stop shop. They order, they receive, sometimes even are part of the payment process there in some way, and which means that they're not always double checking to make sure they're getting the best product or the best price. For that matter, it's easy to just say, well, I keep buying him. By the way, he always gives me the best price without actually going out and double checking to make sure that is the case.
Absolutely. I mean, the amount of work administrators do is just, it's a ton of work, right? And I think it's impossible to think that no one's ever going to make an error, right? Or ever going to, have any sort of accidental error that happens. And I think by putting in technology, you can save some of their time where they get that time back, look at these sorts of things and make sure that holistically we're making the right decisions and, making the right purchases at the right times. But, and a lot of times they can get bogged down with paperwork. If they have a stack of invoices that need to get off to their accountant or somebody to cut payments or cut checks, they're working through that instead of focusing on, am I getting the best price? Should I talk to some different vendors? Am I thinking about how fast I'm getting the product? Or, embracing the technology allows, frees up that time to really focus on at a higher level.
So let's just summarize with some takeaways. I'll throw mine in first, and then you can correct me afterwards or just add on to that. How's that?
Yes.
One big takeaway is make sure you have internal controls in your organization. Make sure that you have purchase orders. Even small organizations, have some system to control the purchasing. Make sure that you have a control that somebody's double checking when they get an invoice that you actually receive the product and order the product and that you got the same price. Number two, make sure that those controls involve individuals that have, that you have a separation of those duties as much as possible. And if you can't, then you might want to consider outsourcing it, at least in the interim. Three is look for technology, as you've talked about, and we've both talked about, to try to find those solutions and keep an eye on current systems, like, the computer systems, both HST and SIS do have built-in portals. They're not the most robust systems necessarily, because they are somewhat limited right now because the technology is just, really kind of developing at this point. Be very leery of single source systems out there, when you're only buying from one distributor, for example. Keep an eye out for new technology, such as the triValence product. See if that can at least, the product isn't totally integrated with everything yet, but I know you're working on that integration with, the accounting systems and the billing systems, the purchase or the purchase order systems too. So I know that's coming down the pike. What do you want to add to that?
The only thing I'd add is just think about where you can adopt technology. Adopting technology, I think of kind of as the three big points are efficiency, right? It's going to help you automate tasks and processes. It's going to free up employee time to focus more on strategic type work. You're going to have improved accuracy. So your technology can help reduce all that human error, lead to more accurate financial reporting, fewer opportunities for fraud, fewer opportunities for errors. And then the big thing that I really like is it gives you visibility, right? And it gives you greater visibility just into your financial transactions and your spending habits and patterns. And that can cycle through our internal controls conversation in the sense that it might make it easier to identify suspicious activity. So I think, focusing on the technology can solve a lot of your internal control problems.
And watch for trends too. As you said, the more information you have coming off of these computer systems that you don't have to manually collect is going to provide you a real insight as to how much it's costing. And we need data like that. How much is it costing us to do certain cases, and the more data that you can get off of a computer system that you can then manipulate to be able to turn into actionable data, the better that you're going to be. So, Alex, it's been a pleasure talking to you. Hopefully this has been great information, actionable information for our listeners. And I hope to talk to you again soon.
You as well. Thanks, John. It's great meeting you.
Thanks.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff, and other events in the ASC industry.
So the Ohio Association of Ambulatory Surgery Centers annual education conference and exhibition is September 19th and the 20th at the Hilton Polaris in Columbus, Ohio, and we will have a special episode including interviews with some of the speakers.
The Idaho Ambulatory Surgery Center Association's annual conference is September 21st and 22nd at the Hilton Garden Inn, Boise downtown.
The Indiana Federation of Ambulatory Surgical Centers Fall Conference and Trade Show is September 28th and 29th at the French Lick Springs Hotel in French Lick, Indiana.
And the New York State Association of Ambulatory Surgery Centers 2023 annual conference will be held October 4th through the 6th, 2023 at the Desmond Hotel in Albany, New York. John will be speaking and moderating some sessions, and we'll have a special episode with interviews, and the whole pile of us will be there.
I think there's going to be 12 of us there. And if you're a New York State client of Ambulatory Healthcare Strategies, we have a special meeting of our New York State clients on the 4th from 10 to 12. Make sure you sign up if you're one of our clients. And then in the afternoon, we have a pre-conference that we're sponsoring also. So it's going to be a busy conference. We're going to have a lot of things to be doing there while those 12 employees are going to be very busy for those 3 days there.
And that pre-conference is for anybody who's going to the conference.
Right, and there's no additional charge. So if you're going to the New York City conference, you just sign up for that. And the Washington Ambulatory Surgery Center Association's annual education conference and trade show is November 9th and 10th, 2023 at the Tulalip Resort and Spa in Tulalip, Washington. And I'll be speaking there, and we hope to have a special episode with interviews this year. We were there last year, and we talked about that possibility, and we're certainly working toward that.
This is kind of early notice, but ASCA's 2024 conference will be at the Gaylord Palms Resort and Convention Center in Orlando, Florida on April 17th through the 20th, 2024. And
I'm going to be doing a session on, it's going to be an interesting time. I've never done this before, on doing financial projections. So it's not something we talk about a lot, so I'm kind of excited to hear what I'm going to talk about while I'm there. And, of course, we'll have our crowd there, and we'll be doing at least 2 special episodes. I think we've been up to 3 now, some of our trips down there, and we have so much fun when we're there. So we're looking forward to it. And don't forget some of our upcoming boot camps. The October cohort of the ASC Director of Nursing Boot Camp is October 31st through November 3rd, and you can get more information at ascpodcast.com. And the January 2024 cohort of the ASC Administrators Boot Camp is January 23 to 26, 2024.
And remember, all of these signups are available on ascpodcast.com or our new website at ASC-Central.com, as well as the on-demand versions.
That's right. And ASC-Central is spelled ASC-Central.com. And also, don't forget about our recorded events, all available also on ASCPodcast.com, our credentialing conference, which we recorded in 2020, the fall 2022 finance and accounting conference, the conditions for coverage conference, which was recorded in 2021, and our medical director conference recorded in 2021. All of those are very, even though they're 2 or 3 years old, there isn't a lot of changes with those particular regulations and that material. So those are very popular conferences, pre-recorded conferences. And you might also be interested in our June 2023 on-demand version of the multi-state conference, which is eligible for 16 AEUs and 4 IPCH credits. And the conference includes some great sessions on infection control, life safety, survey preparation, human resources, an introduction to the Medicare ASC payment system, and pharmacy, as well as staff retention. So as you're getting closer to the end of the year, if you're CAS certified or you're CAPE certified and you find yourself short on credits, this is a relatively inexpensive way to get those credits, as well as a lot of great information. And we also want to remind our listeners to become a patron member of the program, which is also known as ASC-Central. It's an exclusive membership website that provides a one-stop ASC regulatory and accreditation compliance, operations, and financial management resource for busy administrators, nurse managers, and business office managers. Resources include some virtual conferences, links, policies and procedures, forms, and fire and disaster drills. Membership helps to defray the costs of producing the podcast, including research staff, travel costs to conferences, equipment costs, and production costs. For more information, please visit asc-central.com. And thank you for joining us for this episode of the ASC Podcast with John Goehle. If you found this episode informative, we encourage you to share it with your friends and colleagues in the ASC industry. And don't forget to hit that subscribe button so you never miss an episode. We would love any feedback about our episode or ideas for future episodes by sending us an email at comments at ascpodcast.com. And we want to give a special thank you to our great team here who make this podcast possible. Our sound editor is Susan Cronkite, executive producer John Goehle, and our dedicated research team of Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Caloritis, Jim Masters, Amy Durbano, Lori Rodericks, Kathy Foti, Donna Macchio, and Christina Norman. We couldn't do it without them. Our music is provided by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast platforms. Thanks for listening.
This episode of the ASC Podcast with John Goehle is sponsored by triValence. triValence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. For more information about triValence, visit their website at trivalence.com. That's trivalence.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.